So, public policy is the next one that we're going to talk about. It can be really confusing. I thought Brenda O'Day did a phenomenal job. I've sat through a lot of public policy conferences, and they were snooze fest. So I thought she did an amazing job of breaking it down. I really want you guys to just be aware of the very, very basics. We talked about how lobbying is about the issues. So public policy is about the issues. It's not about politics. So that's important to know. The best way for lobbying, the number one goal is to get their attention. So we need to make sure that we can collect facts that support our debate. So why is a sodium restriction a good or bad idea? We need to collect that data to support it. When we're developing any type of policy change, sorry if you can hear the sirens, it is important to collect those facts. That next step is going to be addressing the budget. So how are we going to pay for this new implementation of a policy? We want to work with that congressional staff. So whoever our congressman or congresswoman is, we want to make sure that they know who we are. And especially working with the person who accepts the phone calls within that health department. That's important. We want to look for opportunities to amend a bill. So what that means is just add to a bill. We want to build support. So we want to get as many people on board as possible. The most amazing part of being with a network of dietitians is the ability to have other RDs rally around and really support you on a cause. Maybe like labeling GMOs or getting better education in the school system, right? There's no nutrition education opportunities for kids in school. So important for us to teach that. After that, we are going to introduce the bill to the Congress. In Congress, both houses need to approve in order to pass it, and then it can go to the president. And the president can either sign it or not sign it or veto it. So if both houses approve it, then it's going to become a law even if the president does not sign it. But then, because sometimes maybe the president doesn't want to support it, but the president can also completely veto it. If that happens, then we can revamp and then come back and propose it again and go through that process. So very basic, I want you to understand we need to collect data. And then we need to build support, and then we need to introduce the bill to the Congress. Both houses have to approve, and then the president can sign it into the law, or it becomes a law, or he can veto it. So that's the basic steps I want you guys to be able to write out on the exam.